Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations. And for the last few months, in addition to COVID, we've been talking about other things. So today, we'll talk about COVID, but we're also going to talk about summer safety. So we live in a wonderful place with the most beautiful river, but it can be dangerous. So Lieutenant Brad Odell is with us today, and he'll talk about that. Let's start off with COVID. Again, if you have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org. We got two questions this week, which we'll get to at the end of the presentation. So COVID is not gone away. We're still seeing a fair amount of disease. We had 91 cases today. Although the good news is that the hospitalization rate is low. We only have 9 Douglas County residents hospitalized. And of the ones that are hospitalized at Mercy, only 2 are on oxygen. So the other 7 are there for other reasons, such as surgeries or deliveries or such. So that's a good news. So the amount of severe disease, like we had during the Delta phase and like we had during the Omicron phase, is lower, but still not nothing. I talked to a lot of people who have the disease and a lot of people who are really, frankly, miserable. So let's go through this starting at the world level. So at the world level, the number of cases in the world is up. And that's generally because the number of cases in Europe and Latin America are rising. So Europe has been interesting. They had a pretty quiet spring, but they're really seeing an increased number of cases as people are traveling and vacationing. And especially we worry because when we look at the UK, which has been the best predictor for what's going to happen to us 6 or 8 weeks later, is seeing a sharp increase in the number of cases. So if indeed this continues to hold true, we might see an increase in cases at the end of August or the beginning of September. In the U.S. overall, cases are kind of flat. Places that had a lot of disease early on, like New England, are pretty quiet. But other places in the country, such as the Southwest and Southern Florida, are still seeing a fair number of cases. So we are a little worried about that. When we look at the kind of disease that's causing the cases, you remember that in the fall it was Delta, and then in January and February it was the BA1 Omicron. And then it switched to the BA2, and now it looks like it's switching to the BA4 and the BA5. And the BA4 and the BA5 are especially worrisome because although they don't seem to cause very severe disease, they are causing disease in people who either have had the disease before or are fully vaccinated. So we are seeing now people with their 4th case of COVID. And so they had COVID maybe back in 2021. Early 2021 than they had during the Delta phase, then the Omicron phase, and now they're getting it again. And they tell us that they have felt miserable each time. And so there's still people who are quite sick. The good news, though, is that people have some immunity either from vaccine or previous infections seem to be less likely to be hospitalized. And people who are up to date on the vaccine, that's they've gotten the vaccine and they've gotten the boosters, or have had the disease and the vaccine, seem to be at much lower risk for hospitalization and death. We're still having some deaths, but these seem to be overwhelmingly in people who've never had the disease before and were never vaccinated. So recommendation, still please go ahead and get your vaccine. In Douglas County, we're down a little bit in cases this week, but it's pretty erratic. We'll have some cases, some days with very few cases, the next day with a lot of cases. So I still think there's a moderate amount of disease out there. Sadly, there's other stuff out there too. So we have a number of people who are sick with upper respiratory infections or bronchitis. They get tested repeatedly for COVID and they're negative. So there are other things out there that are causing disease at this point. But there is some good news. One of the pieces of good news is that there's plenty of vaccine available. And in fact, we have new vaccine for kids who are 6 months to 5 years of age. Previously, they weren't eligible for vaccine. Now they are. And there's a vaccine made by Pfizer and a vaccine made by Moderna. And so one of the questions this week is, which one should I get? There's a Pfizer one and a Moderna one. They have the same genetic material. There's a slight difference in how it's made and a slight difference in the schedule. Both seem to work well. So we're saying, go to your provider. We have both available. They can have both available. Get the one you want. But most important is to get the vaccine. So we are highly recommending this for kids 6 months to 3 years. When we look at outbreaks, we are seeing that younger kids get it at daycare and then bring it home to the whole family, not surprisingly. And so we are asking people to go ahead and get their kids 6 months to 5 years vaccinated. The other question is about the CDC levels of disease. And at the CDC levels of disease, Douglas County and actually much of Oregon fits into the high category where they're recommending mask wearing in schools and indoor locations. As we talked a little bit about last week, that designation is a little bit hard to understand because when they look at hospitalizations, they're looking at everybody in the hospital who has a positive diagnosis. And when we're looking now, the number of people who are actually in the hospital because of COVID is pretty small. So we still follow the recommendations. And I would recommend that for people, especially for people at high risk, be sure your vaccine status is up to date. Secondly, avoid places where there's sick people if you can. And then think carefully about whether you want to wear a mask when you're in a crowded area or whether you can actually delay that activity. So I think that's somewhat in keeping with the CDC guidelines, and we would recommend that people do that. But it is confusing because really for the first time in the pandemic, the majority of the people who are in the hospital aren't there actually for COVID. They're there for some other reason. Now that's very different from early on. So early on, and especially during Delta, people were saying, oh yeah, there are a lot of people in the hospital, but most of those people may have COVID, but they're not really sick from COVID. That was definitely not true. Most of the people who were in the hospital then were with COVID, and they were sick from COVID, and they were on oxygen because of COVID. Now, I think because there's higher levels of immunity from previous infection and from vaccine, we are seeing that the majority of the people who are in the hospital are there with COVID rather than because of COVID. But nonetheless, if you're at high risk, we'd certainly recommend that you take some precautions. In addition, we're recommending for high-risk people who have COVID that they consider the use of Paxlovid. Paxlovid is an oral antiviral drug, which really does seem to be really quite effective. But we don't think we have anybody who's been hospitalized after they've taken Paxlovid. So that's a pretty stunning endorsement. So if you're sick, talk to your doctor about whether you'd be a good candidate for this oral Paxlovid. It's twice a day for 5 days, so relatively easy to use. It's not expensive, so this would be a good one to go ahead and use. We're still seeing people suggesting that ivermectin works. As you know, I've been talking about ivermectin for over 2 years now. And the point on ivermectin is there's no data to suggest it works. So if people want to use ivermectin, I'm not going to stand in anybody's way. But there's really no data that it works, and lots of emerging data that it doesn't work. So again, the thing that does work, and there is good data for, is the Paxlovid. So if you are unlucky enough to get COVID and you're either in a high-risk group, over 50, have underlying disease, you should talk to your doctor about getting that. So I think that's enough for COVID. Again, if you have questions, please send it to us at Facebook questions at douglaspublichealthnetwork.org. But it's also now time to talk about the summertime. And as we get to the summertime, I know we're here. I'm seeing the cars from graffiti. And arrival of graffiti weekend is the official sign that summer has clearly arrived in Douglas County. And although Douglas County has got a beautiful river, it can be dangerous. So with us today is Lieutenant Brad Odell, who's in charge of many of the operations at the Sheriff's Office, but including search and rescue. So Brad, welcome.
Thank you, Dr. Bob, and thanks for having me today.
Yeah, so this is an important time of the year. Every year, unfortunately, we have a couple of drownings in Douglas County, and many of them seem to be associated with the river. So tell us what your recommendations are for water safety.
Well, I think one of the most important points for people to remember is that the air temperature may be rising, but the water temperature, especially in the Umpqua River, in the North Umpqua River, is still really cold. And it doesn't take a lot to lose that body temperature rapidly in the water, so that the outside temperature, that ambient air, is really giving people a false sense of security. And with that cold water and the rapid loss of body temperature can really lead to dangerous situations. That, coupled with other things like alcohol and poor decision making, can lead to incidents that have a bad result.
Yeah, and unfortunately, your office then is the one that needs to go and help rescue people with this. So I was in the Navy, and one of the most striking things in the Navy was the cold water drill. So you had to jump into water, which was 65 degrees, which is not even that cold. And really, after a minute or two in the water, you lost much of control of your limbs, and it was really hard to swim out, making it clear that when you're in cold water, especially, that you need to take precautions such as life jackets and avoiding deep water. So they publish the temperature in the Umpqua every day, and it's still really quite cold.
Yeah, it is. It's still very cold, and it is published in the newspaper. I believe that KPIC has it on their website, the YMCA. There's a number of places where you can go to check the current temperature of the river, and making sure that you're staying in water that's safe to swim in, so that you can enjoy your time and recreate safely.
Right. And that's what we're looking for. We want people to enjoy the river, but we want them to be safe. I understand that your group is also in charge of boating at Diamond Lake, and Diamond Lake is still very cold. I was up that way the other day, and there's still snow right around the lake.
Yeah, there is. There's still quite a bit of snow in the area around the lake. The water is very cold. I was just up there for the 4th of July, and I just caution people to making sure that you're swimming in an appropriate area, and really being mindful of how quickly your body can lose that temperature, and how much quicker you lose that sense of your ability to swim and your fine motor skills and everything when you do submerge in cold water.
And that really is something. So, that Navy drill was memorable because you lose control of your extremities. I'm a pretty good swimmer, and it was really hard to swim, as well as your judgment is really quite clouded. So we're strongly recommending that if you're going to be enjoying Diamond Lake on a boat, that you wear a life jacket, and wear a life jacket all the time. I know people say, well, I don't need it now. If I go over, I'll get it. It's way too late once you're over. So we're really recommending that people do this. And certainly for kids who are less than 16, they're supposed to wear the life jacket. We would really love to have a summer with no drownings. What other kind of risks are you seeing in Douglas County?
Well, regarding water safety, I mentioned alcohol, and, oftentimes people, after consuming alcoholic beverages, they think that they are able to swim across to the other side. And oftentimes that's not the case. You tire quickly. Again, factor in the cold weather, if that's the cold water, if that's a factor, and that really decreases a person's ability to do what they think that they can do. And so, being aware of those dangers, as well as dangers from debris in the river. We're still dealing with the after effects of Archie Creek fire, and there's a lot of fire debris that's still in the water. And so folks who are out maybe rafting, being aware and making sure you're scouting ahead of time, making sure that you understand that there are potential dangers. The Oregon State Marine Board has a website where you can check for hazards ahead of time. We try to keep that as current as we can. Oftentimes the river changes quickly, and so there may not have been a hazard one day, but the next day there is. And so making sure that you're scouting ahead of time and being mindful and aware while you're recreating on the water, those are really important factors. You touched on the life jackets. I just want to echo that again. We talk about life jackets all the time, and it's important to have them and to make sure that you're wearing them. If an accident happens, which can happen rapidly and quickly, that things go into the water, you become disoriented, and by the time you're able to get your wits about you and understand what's gone on, that life jacket may be further downstream than what you realize. And so really we implore people to wear those life jackets. It's truly the way to save your life. Now, there's a number of life jackets, that are available, and people often complain about, well, it's not that comfortable, or, it's too bulky for what I'm trying to do. There are options out there, and I encourage people to look for those options. There are inflatable life jackets where you can pull a cord and then they'll inflate if you need it. And there's also life jackets available that if it detects, if it's submerged in water, it will inflate on its own. But there are options, and we encourage people to look into those.
So although your team are great swimmers, I never see them do search and rescue with the water without wearing theirs.
No, that's absolutely right. We have our life jackets. Our crews, anytime we're in and around water, are wearing them. You'll notice our Marine deputies that are out on the boats doing boat enforcement. They're wearing their life jackets all the time as well, and it's because we truly feel that it's that important.
So enjoy the water this. So we in Douglas County have some of the most incredible alpine lakes, incredible wild rivers, and then tremendous shoreline. I mean, one of the few counties in the world that has such a great opportunity for water, but all very dangerous because none of it is warm, and all can provide a great danger. So if I'm hearing you right, be careful of cold water. Be careful about how alcohol impairs your ability. Be wary of hazards, especially after the Archie Creek fire, because these do move around. And the way you can prevent that is don't drink and swim, wear a life jacket, and if you're going to be boating, to scout ahead. So the water is very cold. So I checked on the news review at the YMCA website. It's 65 degrees today. 65 is really cold. You probably only have a few minutes to swim at that point. And one of the things I want to point out is that any water activity where you're in over your knees, you need to do this. So Lieutenant Odell, tell us about whether you need to wear a life jacket if you're just going to kayak in Cooper Creek or something.
Yeah, so that's a great question. Life jackets are required on kayaks, and so they're not there just for your safety, but if something were to happen, if there was an emergency as well. State law requires that adults have the kayak or have the life jacket on the kayak with a whistle or some sound producing device, but you're not necessarily required to wear it. However, we are encouraging everyone to wear it. Again, it's the only way that in an emergency, if something were to happen, you were to become unconscious, that you will stay afloat. Without the life jacket, if it's just sitting on the kayak or if you're sitting on it, it doesn't do anyone any good, especially if there were to have some sort of sudden event where you become unconscious.
As a sailor, one of the things we always worry about is the boom coming across and hitting you in the head. And in that case, you don't have any time to put on the life jacket. And that's really the time that you need to be protected. So thanks for that. Well, good. So my hope for this summer is to go this summer without a single drowning fatality. As a pediatrician, it turns out that drowning is one of the leading causes of death in pediatrics. And so we're very worried about that. So in addition to natural water sources, we're also worried about kids in backyard pools. And over the years, I've had 5 kids drown or be really, really seriously injured in backyard pools. So we're suggesting that with people with backyard pools, they really need to be secured. You can tell your 2-year-old you shouldn't go in there alone, but water is so very attractive to kids that you need to have a specific barrier, either no ladders or a secured fence. We're really looking to go a year without any drownings. All right. Well, any last words for us, Lieutenant?
I appreciate you having me on and letting me talk about this. We do feel that it's critically important. We have some really great partners in the community, like the YMCA, Coastal Farm and Feed. They have donated life jackets, and so there's life jacket loaner stations at some of our boat ramps. If you don't have a life jacket and you're going to tube on the river, check one out, use it. That's what they're there for, but please make sure that they get put back. We really want to make sure that you are safe. And so we have a lot of community partners that are trying to help us out, making sure that the resources are there. If you have a concern, reach out to the Sheriff's Office, Marine Division, and we'll be happy to address that. And again, the overall message is we want people to enjoy the water, recreate safely. We've got some amazing opportunities for outdoor recreation here in Douglas County. But again, we want everyone to do that in a safe manner. And so we just implore you to be safe and have fun while you're recreating.
Great. Well, thank you so much. And everybody, enjoy Graffiti Weekend and enjoy the water, but be safe. Thanks. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. We'll see you again next week.